just want this to work with the ring light and my glasses. I'm gonna put on my contacts. Okay. I know I've been gone. Ooh. I hate contacts. Been gone for a minute. Had something going on, had to study. So training took up several weeks of my life. Ugh. But I get to hang out with you all again. Welcome to Social Work Exam Prep, where we are getting you ready to take and pass your test. These are handwritten questions. I don't have a lot of time for other things, except apparently this trading course, but I wrote these out. Let's hop into it, okay? I have them in multiple colors. Today's question is a medication question. We're going to do a medication-related practice cue. For those of you that hear weird noises in the background, those are my cats. They're not paid actors. They live here for free and ruin a lot of my recordings. Okay. Tardive dyskinesia is a side effect of taking antipsychotics medication that affects which of the A, nervous system, B, circulatory system, C, respiratory system, or D, the muscular system? Did you figure it out? The correct answer is A, the nervous system. And no, the nervous system doesn't have anything to do with you being nervous. Shout out to my cousin who did think that at one point. I could see how the critical thinking at the age of 7 kicked in. So what is tardive dyskinesia? Well, it is a neurological condition that consists of involuntary movements. So for a lot of people, what they tend to experience is facial tics. Usually facial tics around the eyes, cheeks, or, mouth muscles. So it might have like where they're winking or where their jaw and cheek muscles are moving. All of it is involuntary, and all of it usually stems from taking antipsychotics. There are treatments that are available that you could take alongside your antipsychotic to help with treating tardive dyskinesia, but it is a neurological disorder that affects the facial muscles generally and tends to lead to involuntary facial muscle movements. So I know this is tricky because we did put the muscular system on there, but it's not the muscular system that's doing this. It's the neurological or nervous system that triggers involuntary movements in the muscles. So the muscles aren't doing it. The muscles are where they're showing the nerves within those muscles. Nerves within them. Because it comes from use of antipsychotics, long-term use of antipsychotics. Often this is seen in patients who are using them to treat schizophrenia or other type of psychotic disorders or diagnoses. I have seen it in patients who have major depressive disorder and they're taking an antipsychotic because it either helps with some of their symptomology or they might have psychotic features with their major depressive disorder, and so an antipsychotic is. Symptoms of tardive dyskinesia can include the tic that I had mentioned in the cheek, lip smacking, your tongue coming out of its mouth, like protruding out, involuntary, all involuntary. That's going to be the key. So it's not like they're doing it on purpose. So like winking, if it's uncontrolled and non-intentional, that's going to be part of tardive dyskinesia potentially because it could be that facial tic that's up here. Otherwise, controlled winking, that's all me. The muscle groups that are included within tardive dyskinesia generally are found on the head, the face, the neck, and the tongue. So this region. A common medication that was FDA approved to treat tardive dyskinesia is called Ingrezza. You may have seen a commercial for it. They had a bunch of them in 2024. Yeah, 2024. Ingrezza is an FDA-approved medication used to treat tardive dyskinesia. They've been through the whole gamut for approval through the FDA. And I actually saw the commercials for it a bunch and was very excited because I have had patients that have experienced tardive dyskinesia in the past. And it sucks from what they've said. In fact, I've seen their symptoms of TD. And it's nice that they no longer have to pick between their mental health management and then what side effect could come from this medication that has helped their mental health so much. So, Ingrezza, very commonly used to treat tardive dyskinesia. Okay, well that's it for this question. Come back again when we have another one. I'll probably be wearing this shirt because I plan to record a couple things tonight. So, yeah. Have a good night. See you next time. Stay strong with the study game.